Hi, in this video I'll share with you what trigger points are, then answer most of the common questions people ask about them, like why they keep coming back and how you get rid of them permanently. Here's a list of things I'll be covering. Now for each of these I'll give you a simple straight to the point answer and have links in the description to where you can get more info. Question 1. What are trigger points? Well, trigger points, or myofascial trigger points to give them their full name, are those tender lumps in your muscles that therapists find. Now they're actually part of your muscle that is tightened and won't let go, bunching up to form a lump. Now this causes the muscle itself to tighten, which presses on the blood vessels, restricting blood flow. What you end up with is a bunched up ball of muscle, the whole muscle being tight, and a build-up of waste products in a lack of nutrients because of the reduced blood flow. Now, often you don't know trigger points are there until the therapist presses on them. But if left, they can start shooting pain like shown in this chart, which means they can be a major part of problems such as back, neck and shoulder pain. So, what causes trigger points? Well, there are many causes including injury, muscle overload and emotional stress, but the biggest cause is where muscle tightness restricts blood flow. Now that causes a build-up of waste and a reduction in nutrients in your muscle, which is perfect for growing trigger points. Now this is why trigger points are so common, where things like repetitive movements or postural issues such as sitting at a computer cause muscle tightness. Now the big issue is, if you remember before, trigger points themselves cause muscle tightness. Now that means once you get a few trigger points, they create the perfect environment to grow and develop more. Now basically you get a snowball effect. So what's the best treatment for trigger points? Now the key to this is understanding what happens before trigger points start hurting. Now they start small, tighten your muscles reducing blood flow and keep growing, and eventually they get big enough to hurt when they get aggravated. Now when this happens, there's two things the treatment needs to do. Settle the lump down so it stops hurting, and then get rid of the lumps and restore the health of the muscles. Now there's been a lot of clinical trials testing treatments such as needles, lasers and various massage techniques, but all they test is the first part, getting out of pain. And none test getting rid of the lumps or restoring the health of the muscles. So, if all you're after is getting rid of the pain, according to the trials, there's not much difference between the treatments. If for actually getting rid of the lumps and restoring the muscles, that's another story. Now there's really only one choice, which I'll discuss later in the video. So what's a trigger point release? Now the basic treatment for a trigger point is sometimes called a release. Now this is where the bunched up part of the muscles is helped let go or release. Now this allows the whole muscle to relax, which allows the blood to flow more freely and actually relieves the pain. Now the classic way to release a trigger point is known as pressure release. Now this is where pressure is applied to the lump while the pain gradually fades. Now therapists often do this with their thumbs or elbows, but it can be done with various tools. Now, therapists have been doing it like that for probably centuries, but we now have alternative ways that are less painful and often more effective. Now, examples are needles and lasers, but arguably the easiest to apply and most effective is the use of vibration massage. Now, don't confuse these with massage guns, which are not suitable. Now, to apply vibration massage, you simply put the head of the machine like this on the muscle over the lump. Now the vibrations from the machine penetrate just like ultrasound and have been scientifically shown to make the lump release, relax the muscle and increase the blood flow, which is perfect for dissolving a trigger point. Now it's easy, much safer and usually no pain. So do trigger points go away on their own, and why do they keep coming back? Now I think you probably worked that one out already. Now quite often you'll have someone who will get sore from a trigger point, then later the pain goes away. Have the trigger points gone? Of course not. All that's happened is that the trigger point has settled down so it's not hurting. It's still there and the muscle is still the ideal environment for growing them. Now next time you aggravate the trigger point, it'll arc up again, then eventually it'll grow big enough so it'll hurt all the time. Now this is exactly the same when you get some massage, needles, lasers or whatever. Now the pain goes away, you think you're fixed, but the problem is still there. As a chiropractor for over 27 years, I've seen this as a huge problem. Now, people get some treatment and think they're fixed, then the pain will come back needing fixing again. Now, the longer this happens, the worse the underlying problem gets. It takes more treatment to fix the problem, and then eventually it gets too hard to fix, and the patient ends up on medications for the rest of their life. So, how do we stop this? Now, the basic way to stop this happening involves continuing the therapy for long enough after the pain goes so that the lumps continue to diminish and the health of the muscle returns to normal. Now, if you do that using professional massage needles and laser, that would need countless more appointments, which should be very inconvenient and very expensive. Now, professionals sometimes try and get around this by prescribing self-applied pressure techniques using balls and rollers. Now, the problem is that this is hard to do, hurts like hell, and it's not that effective. Now, as a chiropractor, I saw so many people hurt themselves for very little benefit that I gave it up as a bad joke. Now, that's when I had these built. Now, genuine vibration massage, as distinct from massage guns and percussion, is an excellent therapy for trigger points. Now, all we needed was an economical, easy-to-use machine for patients that was effective as the machines professionals use. Now, if you have one of these, with a bit of professional advice, patients can find the lump, sit the machine on for 30 to 60 seconds, and it dissolves them beautifully. Now, this can easily be repeated regularly over time, which is a big part of taking care of the problem. Now, do anti-inflammatory drugs help trigger points? Well, of course not. They just relieve the pain, but the lump's still there, the muscle's still tight, and there's still not enough blood flowing. In one clinical trial, self-applied trigger point therapy and anti-inflammatories were actually directly compared. Now, the anti-inflammatories gave a small reduction in pain only, while the self-applied trigger point therapy gave a large improvement in pain and function. So does fibromyalgia cause trigger points? Well, actually it's the other way around. Trigger points are a big untreated cause of fibromyalgia. Now, what happens is over time, pain from untreated trigger points bombards your nervous system, causing it to become sensitized. Now, scientists have relieved fibromyalgia by injecting the trigger points as anaesthetic, stopping them from bombarding the nervous system. And of course, anaesthetic wears off, so that was only a temporary solution to show cause and effect. Now, the long-term solution would be to effectively eliminate trigger points, which you've already discussed. Now, trigger points affect sports and athletics performance. Well, anytime you've got a muscle that's tight, has restricted blood flow, and a bunched up lump, of course it won't perform as well. And being tight, it'll be much more prone to being injured. Now, if you have some sort of regular therapy like massage or using one of these to find and treat those trigger points, you'll be a lot better off. Now, as an example, I found a few studies where athletes were given regular vibration massage and they had more strength, fitness and endurance. Now, the vibration massage didn't make the muscles stronger, they just helped eliminate the problems that were inhibiting them. So, what's the difference between trigger points and acupressure points? Well, trigger points and acupressure points are about 95% the same points. Now, people have had these lumps in their muscles forever. Now, when people found them centuries ago, they didn't have science as we know it, so they made up stories. Now, in more recent times, science have investigated them, calling them myofascial trigger points. And by applying science, they've learnt what they are, how to identify them, and importantly, how to treat them better. So, even though the points are basically the same, the way they're used is a lot different. Now, to put it simply, a traditional acupuncturist will have the story they made up centuries ago about meridians, life forces, and whatever else they have, plus what amounts to a recipe book based on what they found with people with similar symptoms centuries ago. I.e., if you have condition A, you press on points X, Y, and Z. On the other hand, if you see a professional who uses therapy based on trigger points, they know what to look for so they can work out exactly what you have, and they have scientifically worked out ways to treat them. Do trigger points cause headaches? Well, trigger points in the head and neck muscles have been shown to be a major cause of the most common form of headache, tension headaches. Now, trials where these have been treated gave excellent relief. And this is something you can easily do yourself. Now, as we saw with the trigger point chart, pain from trigger points can shoot almost anywhere in your body. So it should be no surprise that they're a big part of most musculoskeletal pain. Now, in the description I'll give you details for our guides to many specific conditions such as back pain, shoulder pain, headaches, etc. Now these will show the common trigger points involved, how to find them, and how to treat them. If you have any questions or comments, please shoot me an email or pop them in the comments. Hey, thanks very much for watching. It has been most appreciated.